For more than 330,000 people in the state will soon change.
Louisiana's contract with United Healthcare will end December 31st. It's one of 6 companies which provide Medicaid coverage in Louisiana. Capitol correspondent Alexis Maroney is in the newsroom with why lawmakers are worried about this change.
Michael, Sylvia, some lawmakers are nervous that cutting United's contract this close to the end of the year would leave all those people scrambling to find another provider. They wanted to give United an extension. Leaders from the state's Department of Health are confident it won't be a problem.
1 month ago, Louisiana lawmakers recommended the state sign off on a deal that extended Medicaid coverage through the private company United Healthcare.
Major concern that I think we all share on this committee is the abruptness of this decision.
But the very next day, the governor's office announced that deal, the contract, would end at the end of December. And according to Attorney General Liz Murrill, Louisiana's Department of Health, which had to sign off on the deal, had not been told her office had issues with United Healthcare's record of compliance.
I think it was just an inadvertent lack of communication. It's not insidious. It's not anything intentional. You know, they were doing one thing, I was doing another.
Back in 2022, then Attorney General Jeff Landry sued United Healthcare and its pharmacy benefit manager, saying the group overcharged for prescription drugs. When Murrill became Attorney General, that lawsuit continued.
They should be more compliant and more willing to engage with us.
But Murrill told a Senate Joint Committee of Health and Insurance that United had not been compliant and has not handed over documents that her office has requested.
You know, it is a gift that they get to keep working for the state of Louisiana and get paid more than $2 billion a year.
However, some senators expressed concern about the short timeline and what the expiration of United Healthcare's contract means for Medicaid recipients in the new year.
But just like writing a research paper, more time would probably turn out a better quality product.
LDH says in some cases, different people in a family will have different coverage from different providers. They say part of this transition will be to make sure that everyone, if a family chooses to, has the same coverage plan.
To address the short timeline, legislators want to extend coverage 90 days and reassign health care plans for Medicaid recipients to other companies.
Healthcare is very, very complicated, and so we need to ensure that we're giving the Department of Health and this administration more time to do the things that they need to do to ensure that there's not this gap in coverage.
LDH says there will be multiple opportunities for Medicaid recipients to change their health care plans if they're not happy with the coverage when the new year arrives. Live in the newsroom, Alexis Maroney, WBRZ News 2.